This morning, UNCG is running an all-day training for nursing students, simulating a mass casualty scenario to give them hands-on experience in high-pressure situations.
The event is taking place at Faust Park near UNCG's Nursing Instructional Building. That's where we find our Giselle Thomas. Giselle, talk about great hands-on learning.
Yes, hands-on learning is exactly what it is. We're able to see some of that setup process begin. I'm actually here with Tommy Mann. He's the director of simulation here for UNCG. I want to ask, I know this morning we saw students, faculty, staff, everybody come together as they're starting to put this up for the actual simulation later. Tell us about just how this gives that hands-on experience and what can students expect to see.
Perfect. Good morning to you.
Good morning.
So this event today is for our senior nursing students, and what that allows them to do is to take their clinical skills and what they learn in the classroom and apply it hands-on in these critical situations that we've staged for them through 4 different stations today. And it's all about them applying that knowledge and growth in that knowledge and building that confidence and that strength in our students.
I know it's so much different reading from a book than actually reenacting it in real life.
100%.
Yes. I wanted to ask about the importance of being able to do that. And then also I know from what you guys said, this is kind of a part of the field hospital portion.
Yeah.
Tell us about some of the other portions that students will be working with.
So today, some of the students that will go through our field hospital, we have a triage and treatment area where they make clinical decisions and judgments in about 2 minutes per patient. So we're teaching them how to do those skills quickly and assess patients and move to the next. Inside the nursing instructional building, we'll also be doing a Stop the Bleed certification course. So we're one of the only schools in North Carolina that certify our students in Stop the Bleed. So when they get out the door, they have that on their resume to kind of help build them up. We also are doing a community impact station today that helps with their decision making on communities that are impacted through storms or crisis events, and how do they deal with those patients, how do they deal with personnel walking in off the street, and how do they make those decisions to help them out.
And speaking of that, Leslie, I know the state also is giving money to help and push forward nurses in rural areas. I want to ask about the importance of having those type of resources. I know the whole reason to have help in those areas is because they're not able to get it in more populated areas.
Absolutely. Our nurses here, one of the perks of our program is that 90% or more of our nurses stay in this community and they go back into their communities, into these areas and these rural areas. Having events like this allows them to hone their skills when they know they may not have all the resources we have in larger cities or metropolitan areas. And that gives them that bandwidth to make that clinical decision, to help patients make more educated decisions. But we're feeding back into our community and feeding back into those lower population areas and rural populations.
Just a reminder for those who might be near the area, remember this is a simulation, so you might hear sirens, you might hear radios. Just remember that this is a reenactment of a crisis situation. Everything will be okay here on campus. Also, it's not open to the public, it's for students, but if you want to see, there is a perimeter so you can observe outside of the perimeter. Starts at 8, ends around 5:30. We'll make sure to be there. Live in Greensboro, Giselle Thomas, WFMY News 2.